Hello, and welcome to It's All About Your Health, Straight Talk with Dr. Nancy. My name is Nancy Greer-Williams, and I am a health researcher for the University of Arkansas for Medical Sciences.
There are a lot of different types of heart disease, and probably so many that it'd be difficult to cover all of them. I'd like to focus in on about three major ones. The first one would be the blockage in blood vessels that keeps the heart from getting enough blood for its needs, and that we call coronary artery disease. That's probably the most common one and one of the more dangerous ones. The second type of heart disease would be what we call congestive heart failure, and that's a problem with how well the heart is able to pump the blood through the body. And so that's a particularly severe one and causes many deaths each year because of complications that arise from that. The third major problem that you can have with the heart is rhythm problems or problems with the timing, the heart beating too fast or beating too slow. Sometimes it will become irregular in how it beats, and with that irregularity it just cannot do its work as well as we would like for it to. The symptoms that you would have if you had heart disease can be quite varied. If you have blockages in your arteries, the most common way people will notice that is to notice some type of pain or discomfort in their chest area, particularly right in the area over their heart. Okay. That pain can sometimes go into the arm or into the neck. But what is typical of it is for it to occur when people are exerting themselves, when they're doing something more than the average amount of work, when the heart has to do a little bit more than it usually has to. They'll notice that discomfort come, and then it will go away if they pause and rest. Okay. Sometimes that pain can even come on at rest and be indicating a heart attack or a very recent blockage in one of those arteries. So that's the coronary artery disease. Heart failure often comes when fluid accumulates in the body because the heart just cannot pump the blood with the normal efficiency. Okay. That will cause shortness of breath. People will try to get up and do things, and they'll say, I just don't feel as if I'm breathing as well as normal. It can get so severe that they have the shortness of breath even at rest, but most commonly when they exert themselves. The heart rhythm problems come and they notice their heart seems to be beating irregular. They'll have
faster or slower.
Yes, and it can give them a sensation that there is just something funny going on in the inside of their chest. It can feel as if the heart's running away with himself or pounding very, very strongly. Or sometimes they will notice the irregularity and say, it just feels like my heart is skipping a beat. So depending on the kind of heart disease you can have different kinds of symptoms. There are risk factors for developing heart disease, and the five major ones are high blood pressure, diabetes, high cholesterol, a family history of having a very close relative, that's a parent or child with heart disease, and smoking. You would probably know if somebody in your family had problems with heart disease. Smoking, of course, is one that's pretty obvious. But you may not know that you have problems with blood pressure, diabetes, or cholesterol unless you've had a physical examination and the appropriate testing. And I think it's very important to know that many forms of heart disease take a long period of time to acquire, so we want to make sure that we prevent it from coming on rather than just dealing with it once it comes on. Most people don't realize how many people will die from heart disease. We worry about cancer or we worry about a car accident, but in truth, more people are going to die because of a problem with their heart than any other cause. In fact, about 30% of the population will finally die because of some type of heart disease. And the one way that we can help prevent that is to address these risk factors before heart disease even comes about. The things in the diet that we can do to help out would be, number one, to be aware of the salt content. Most of us eat more salt than we ought to be eating. Now there's a little bit of discussion among medical experts about exactly how low we should drive our salt content. But at the very minimum, it would be to not add any salt to our foods and avoid anything that has more than 300 milligrams of salt per serving. You can determine that by looking at the labels on the side of food can. The second thing would be to increase the content of fruits and vegetables because these have a lot of fiber, and any other foods that have high fiber content can also help reduce your risk of developing heart disease. The third thing is to avoid foods that are high in saturated fats. What we realize is not all fat is the same. There's a monounsaturated and a polyunsaturated fat. You can see these on labels. Those are not nearly as bad for you as the saturated fat. I know that gets a little bit complicated, worrying about the kind of fat that we are or we're taking in. But not all fat is the same, and the worst fat for you is the saturated fat. And by being aware of how much saturated fat in the food you're taking in can help also lower your risk. Well, what we do as far as exercise is concerned is very important to keep our heart as healthy as it can be. Most people don't get enough exercise. In fact, it's estimated that only 20% of Americans are getting an appropriate amount of exercise. What we recommend is that people do 30 minutes of activity most days of the week. Okay. Now, you don't necessarily have to go to a gym in order to get that activity. Any type of activity that you do, if you go outside and mow the yard for 30 minutes, if you take a walk around the neighborhood, certainly you can jump in the swimming pool and do 30 minutes there. Whatever it is that you like to do that'll get your heartbeat up to a faster level, some type of exercise that will begin to cause a mild degree of shortness of breath would be appropriate. Whatever you like doing, that's probably the best type of activity for you.
Thanks for watching. Our goal for this program is to give you good information that you can trust on health topics that you can use for you and your family to live a long, healthy life. If there is something in this message you want to know more about and you live in the state of Arkansas, take a moment to talk with one of our health experts at your local area health education center.